12. Data shows that about 1/3 of Hoosier adults care for someone 55 or older. Well, today I'm joined with Katie Greenan, who has created a pilot program for healthcare professionals on exactly how to care for the aging population. Katie, good morning.
Good morning. I interned here years ago, so it's nice to be back.
Well, we're happy to have you back. We're going to put you to work because we have to talk about this program. And I know you are partnering with two organizations to put this on, and especially at this time, it's such good use because a lot of people are having to juggle staying at home and taking care of their loved ones while going to work every day.
Yep, I'm collaborating with SEQOA Aging and In-Home Solutions and also the Center for Aging and Community at the University of Indianapolis. And communication is essential because our relationships depends on it. However, most education programs lack training, so students become practitioners who lack knowledge and confidence when it comes to communicating with patients and clients. And I have an example to share that happened recently.
Really?
Between a doctor and a patient. So a patient finished chemotherapy and goes in for an appointment, asks the doctor, did the chemo work? And the doctor says, why do you want to know that? So that is an example of why training is necessary. The doctor could have responded by saying, are you asking if the treatment was effective?
Perfect. That makes sense. What are some other topics that you're going to delve into? Because that type of communication is just one of the many things that you deal with when you're responding to an aging population.
Yes, we'll be talking about topics that are uncomfortable, such as end-of-life issues, sexual and mental health, family and financial matters, also loneliness and isolation.
All things that can prolong life if you tackle them head on and early on. So great things to be talking about. So on top of that, there are strategies to get into some of those uncomfortable areas. What are some tips that you can give us that we're going to learn about in the program?
There are actually 3 things that anyone can practice. Number 1 is asking open-ended questions. So, for example, instead of asking, how are you feeling today, which would elicit typically a one-word response, someone could ask, what activities would help you feel better today? And that leads to the second strategy, which is actively listening to understand a person's wants and needs. So talking and interrupting less. And then number 3 would be summarizing. So following up with, okay, so it sounds like going outside for a walk today will help you feel better. Let's do that.
It's also kind of creating that bond between the person as well. You're not just being their caretaker, but you're truly being a friend and a confidant.
That's right. That's exactly right.
Perfect. Well, I have to say, great tips. We are so thankful that you stopped by to tell us all about them. And if you would like to check out this program, how can we do that, Katie?
Oh, well, you could go to UIndy and I'm online, so you could look me up, send me an email. I'd be happy to share it with you. You can also check on UIndy's Community Center for Aging and Community.
Wonderful. We can do just that, and we'll have all that information for you on wishtv.com.